Good afternoon, dear students. So we will continue in the previous class. We have completed learning about cognitive behavior therapy. So we have learned about CBT. Now we will be learning in detail about the behavior therapy, what it is, and what all therapies are there, and at least we will discuss about the therapies that is under the behavior therapy. Now, so what is a behavior? From last time, which behavior, when you say behavior therapy, okay, when you say behavior therapy, that means we give therapy when there is a need, right? We give therapy when there is some maladjustment. We give therapy when there is the not the disturbances or the uh, maladjustment or malfunctioning, or there is disintegration, or there is something that is a problem, then only we give therapy. So what behavior therapy? From the name itself, it is a therapy given to the behavior. So what type of behavior? Now let's see. A behavior is considered to be maladaptive only when it is age appropriate, when it interferes with adaptive functioning, or when it is misunderstood by others in terms of cultural appropriateness. The behavioral approach to therapy is that people have become what they are through learning process, or more correctly through the interaction of the environment with the genetic empowerment. Again, see, whenever we read anything about the deviation in the, be it in the cognition, be it in the behavior, be it in the attitude, be it in any sphere or aspect, always keep in mind, remember, there is always the existential model says there is always the equilibrium that every day a person or an individual try to balance and face the everyday life. Okay, now, so what are those everyday sphere? Again, remember, keep in mind, never forget, there is always an interrelation, interdependence, communication between the biological sphere, psychological sphere, and social sphere. Now, what happens here? Behavior therapy is a therapy that which is given to behavior. What type of behavior? You don't give therapy if a behavior is an adaptive one, or a good one, or a well-maintained one. We give therapy only if it is a behavior which is considered maladaptive. Now, when do we consider a behavior maladaptive? Concerning with the age, concerning with how the age in that particular milestone, that particular person, with respect to age in that particular milestone, with respect to the cognitive development or the personality development, again, keep in mind psychosocial theory, Erikson personality development theory, okay? Keep in mind all those different stages. Concerning with all those, anything which interfere, any behavior which is not adaptive, which interfere with the normal adjustment or the adaptive behavior of the person, right? And which is not appropriate, again from the cultural sphere, which is not appropriate related to the culture. Some behavior, it is, if it is not accepted in one culture, it may be accepted on the other culture. So please keep in mind, a behavior is considered to be maladaptive only when, according to the age, appropriate to age, it interferes with the adaptive functioning, and it is misunderstood by others in terms of cultural, or when it is misunderstood by others in terms of cultural appropriateness. Now, so how do we see behavior? We have seen in the CBT that any behavior arise from the learning, from the person being conditioned, right? in his or her interaction in the biopsychosocial sphere. Right, now let's continue. So what is behavior therapy? It is again a psychotherapy. We have learned in the first class when we had studied we had studied therapies. The first class that I have explained that we have discussed together is about psychotherapy. We have seen extensively what psychotherapy is. So behavior therapy is again a form of psychotherapy. Now over here, see from the name, in the previous classes we have seen cognitive behavior therapy, where to bring about a change or to bring about any outcome, we work with the cognition first. That influences the behavior, thus it brings about the adaptive changes. Now over here we do not the from the name itself, it focus only with the faulty behavior. It focus only with the problem behavior, rather than it does not focus on those co-belief, those automatic belief, which is governed, which are the principles governing the cognitive behavior therapy. Okay, now instead of, probing the unconscious or exploring the patient's thoughts and feelings, where we do psychotherapy, psychoanalysis, right? So, psychodynamic therapy. Here in behavior therapy, the behaviorist or a therapist tries to eliminate the symptoms by modifying ineffective or maladaptive patterns. Now, so over here in CBT, we try to help the client or the individual understand the insight of his or her problem that governs or that influences behavior. Whereas in behavior therapy, the therapist only deal exclusively with the symptoms. CBT, we deal directly with the causative, deeply seated causes. Right, now over here we deal in behavior therapy, the principles is it work only with the symptoms, or it works only with the behavior. What does it do? Only by modifying it. And how does the therapist help the client in modifying? By replacing the maladaptive behavior with the adaptive behavior by applying all the different learning techniques. Okay, now let's proceed. So again, so it is a systematic application of scientific principles. Each and every therapy which is given has its own scientific principles in it. Right, now, always keep in mind the theories of learning, the all those different theories that you have learned in psychology, okay, and all those developmental theory that we have learned in your child health also. Right, so over here, it is behavior therapy is a systematic application of scientific principles of learning, and it is also a form of psychotherapy that aims at changing maladaptive behavior by substituting it with adaptive behavior. Again, why is the same principles of psychotherapy, those phases where a person tries to understand first, and then you interpret, and then you give the reconstruction or the re-education. Okay, now, so let's proceed. Now, so how do we change the behavior? Okay, now again you have learned about conditioning right from your class in first year in psychology. We all know about conditioning, and how does our personality develop? How does our behavior develop? Learned behaviors, they call this, okay? Through conditioning. So definitely, if a behavior is maladaptive, the same conditioning principle, that means we learn because we have been doing it again and again, we have learned it and it has become our behavior. Now, to change this, so to correct this, again, we apply the same conditioning. Okay, so what principles do we apply here? We apply a classical conditioning model by Ivan Pavlov. You all remember that dog, which you've learned in first year. Okay, and we apply the open conditioning model by B.F. Skinner. Okay, now let's continue. So, what is there in the classical conditioning? Classical conditioning is the Ivan Pavlov, and the open conditioning is the B.F. Skinner. Okay, now in the classical conditioning, a process of learning introduced by Ivan Pavlov, a Russian psychologist in 1936. It involves learning by association of a neutral stimulus with an unconditioned stimulus at the same time before a reflex response. Now, what happened here? He pairs two stimulus. Okay, now, so a neutral stimulus with another stimulus, they pair it up so that they bring about the changes, okay, the change in behavior, which after a person has been exposed to it again, and after the exposure, it brings about the changes involuntarily. That means automatically the behavior change. Okay, now over here, you all have seen, you all know this behind. Let's just review. There is a door. Okay, when in the first one he paired it with food. Okay, so there is salivation. Now in the next time he only bells. Okay, a neutral stimulus is there. A bell is ringing, so a dog thought that, oh, there the food will be there, but no food, only the bell. Next step. Unconditioned response, there is salivation whenever he paired the neutral stimulus with the unconditioned stimulus. So automatically, next time, even if there is no unconditioned stimulus, the minute he hears the bell, the dog knows that there will be food, so he starts salivation. This is the principle where pairing up of stimulus, how does it bring about a change. Okay, now you have learned about this. You know in detail about it. Now let's continue. Now, what happens in the operant conditioning? In the operant conditioning, it is a process of learning introduced by American psychologist B.F. Skinner. Okay? It focuses on responses that are elicited by specific objects or events. Okay, now what happened here? Positive reinforcement and negative reinforcement. You have learned about this. We are only reviewing it. I will not go into all the details of this open conditioning because you have been learning it from first year. Okay, let's just review it. So what happened here? It focuses on responses that are elicited by specific objects or events, and additional responses is given to the consequences of the behavioral response. That means every time there is it is more when we reward it positively, so the behavior increases. Okay, and when we remove what is due but we do not get, that is negative reinforcement. Okay, now the connection between a stimulus and a response is strengthened or weakened by the consequences of the response. A stimulus that follows a behavior is called reinforcing stimulus or the reinforcer, whatever, be it positive or the negative reinforcement. Now, so what happened here? When the reinforcing stimulus increases the probability that the behavior will reoccur, these are called positive reinforcer, and it is the positive reinforcement open conditioning. Okay, now negative reinforcement is decreasing the probability that a behavior will reoccur by removal of an undesirable reinforcing stimulus. Okay, this one. Now, so what are the assumptions in the behavior therapy then? Based on these two, the open conditioning and the classical conditioning, we have the major assumptions, which are, that means anything that is learned, all behaviors is learned. So anything which is learned can be unlearned and change. Okay? So all behavior is learned, be it an adaptive behavior or be it an maladaptive. So when it is learned, so again we can through the process of behavior therapy, you can unlearn them and then change, replace the maladaptive one with the adaptive one. Okay, now beings are passive organism that can be conditioned. See, mark this line, huh? Human beings are passive organisms that can be conditioned or shaped to do anything if correct responses are rewarded or reinforced. That means either through positive reinforcement or negative reinforcement, it does bring about a change in the behavior. So, maladaptive behavior can be unlearned and replaced by adaptive behavior if the person receives exposure to specific stimuli or reinforcement for the desired adaptive behavior. So these are the assumptions. All behaviors are learned. Okay. Now, all behaviors can be conditioned. Now, when we as human beings, we can condition, so definitely all maladaptive behavior can be unlearned and again we can learn through the process of behavior therapy. Okay, now let's go on. Behavioral assessment is focused more on the current behavior rather than on the historical antecedents, or rather than we take full history. Now, when does the historical antecedents takes place? Only when the in the principles of cognitive behavior therapy, because cognition is deeply seated, right? Remember, the conscious, unconscious, and the deeply seated, repressed, regress. So how does these thoughts become repressed, regress? From the word and from the history. Now, that is activity, whereas in behavior we focus with the now and then. अभी जो क्या है, क्या मतलब क्या problem है, we focus only with that. If suppose it stems right from the deeply seated one, then we go into cognitive, then we go into CBT. Okay. Now, treatment strategies are individually tailored. Why is it individually tailored? Because no two individuals are the same. And no two individual will have the same biopsychosocial sphere relation. Okay, now behavior therapy is a short duration therapy, easy to train, and it's cost effective. Why is it a short duration? Because we only handle with the now and then. Whereas CBT, where you need to do a lot of catharsis, where you need to do a lot of ventilation, it is a longer procedure. Okay. Now, total duration of the therapy is usually 6 to 8 weeks. This is about behavior therapy. Now, how does behavior therapy works? What are the principles? Okay. Now, let's see this. The principles of behavior therapy are close observation of the behavior, concentration on the symptoms as target for the therapy, general reliance on principle of learning, okay, empirical approach to innovation, and a commitment to objective evaluation efficacy. Now, what happened here? Now, the major principle here is we need to have a close observation, because if we do not observe closely, we will not be able to understand which behavior is the current symptom and which cause problem with the adjustment, or which is a maladaptive problem. Right now, it rely basically on the learning. Again, that's why we said behavior therapy lies exclusively on the assumption is all behaviors are learned. Right, so principles of learning, you have learned in CET. If you have forgotten it, please you can go back and you can review that again. Okay, now, and it is it is innovative in its approach, and the efficacy is objective evaluation. Remember, not by emotional or rational interpretation, but by objectively interpretation or evaluation. Okay, now, so let's go on. Now, when is behavior therapy indicated? Which type of patient needs behavior therapy? Substance use is number one, right? We have seen, since it is a connection of these substance use class, so you will understand there is faulty with their behavior. So that is one, like tobacco dependence, alcohol abuse, all anxiety, mostly anxiety disorders like panic, OCD, post-traumatic stress disorder, general anxiety disorder. We will learn these at 40 after we in the subsequent classes. We have learned about this in the clinical, but again we will be discussing it. Okay. Now, mood disorders like bipolar depression and major depression, in case of schizophrenia, in case of eating disorders like bulimia and anorexia nervosa and obesity. This is in F50, okay, which we will be learning, and this is a presentation by. Uh, we will discuss more in the subsequent presentation class. Okay. Now, again, the other indications, it is indicated in psychosexual disorder like gender identity disorder and homosexuality. It is indicated in psychosomatic disorders, okay, like insomnia and hypertension. It is indicated in childhood disorders like mental retardation, habit disorders, and conduct disorder. And it is indicated in geropsychiatric disorder like dementia, and personality disorders like criminality and sexual deviation. So these are the indications of behavior therapy. Now, what all techniques we use in behavior therapy? Behavior therapy is the where we focus only on the maladaptive behavior. Now, so how do we change that maladaptive behavior into an adaptive behavior? So we have these techniques here which usually therapists apply and work together with the client. It is systematic desensitization, flooding or implosion, aversion therapy, cognitive behavior therapy, modeling, shaping, contingency contract, extension, assertiveness, and social skill training. Okay. Now these are the main ones of the behavior therapy, which usually the technique which they apply. Now you may when you further read, you may come across other therapy too. So please do read the textbook and other research articles too. Now, so what exactly is systematic desensitization? Remember, we are in the technique of behavior therapy. Behavior therapy, the principle is we are focusing on the maladaptive behavior. Now, maladaptive behavior because it is not appropriate. And our aim is we want to change that maladaptive behavior with an adaptive one. So how do we bring about that current change in the current problem or the current behavior? We have these techniques. Now let's try to understand these techniques one by one. This is just briefly. So please do refer and do read up from your textbooks too. Okay. Now, systematic desensitization is developed by Joseph Wolf. Okay. Now, what is the goal of systematic desensitization? See, from the name itself, it is called systematic. Okay. Sensitization. Desensitization. That means systematic is what? Systematic is step. Systematic is one by one. Each level, step 1, step 2. There is a whole system, step by step, the whole process. Now, desensitization means we help the patient to not to be sensitive, or we help to recondition that problem. Okay, now, so the goal of systematic desensitization is to help the patient change the response to threatening stimulus, or to overcome their fear of a phobic stimulus. Most of the case here it is in case of phobia. Okay, usually they give this in case of phobia. Okay, where people have phobia against this. Okay, so many things. Now, systematic desensitization. Now, we have a client who have phobia against many things. So, what do they do? So, over here, so what are the steps? Okay, so if I go to a therapist and my therapist use a technique of systematic desensitization. The therapist will follow 3 steps. Okay, 1. Relaxation training. Relaxation training means the therapist usually before he deal with my phobia or with my anxiety related situation or with any situation that cause me to that brings fear, brings anxiety in me. Before that, he or she teach me all the relaxation training. Relaxation training can be in the form of progressive muscle relaxation. It can be in the form of deep breathing exercise, or okay, all those different relaxation training. Okay, first therapist will teach me. After that, then it goes into the next step, hierarchy construction. I told you whatever systematic, right? So hierarchy of anxiety provoking or fear situation is constructed. That means I'm scared of this, I'm scared of this, I'm scared of point, I'm scared of A, I'm scared of B, I'm scared of C, I'm scared of D. Now what does the therapist do in this technique? He or she asked me to rank those the intensity of my fear or anxiety provoking fear situation. Okay, now after he had asked me to rank it, right? So slowly out of 10 or out of 100, okay, most of the case we make them rank 1 up to 10. So instead of dealing with the number 10 first, the therapist helped me to handle first with my rank 1 fear, okay, and then once I have been able to handle that, I've handled the level 1, I go to the rank 2. Okay, that means I have gained courage. I can handle the next rank, which to me it is huge. To me, it is a stimulus that causes a lot of anxiety. Okay, so that is how he or she goes in the ranking. Now, after he have done that, after he or she has done the ranking with me, then there is gradual exposure of individual from the least ranking to the highest rank. So hierarchy from the least to the high. That is systematic desensitization. That means he teach me how to respond from the lower rank first. Once I've handled that, I go to the next higher rank. Once I've handled that, I go to the rank 3, 4, 5, 6, like that. So that is the steps of systematic desensitization. Now, the other technique is flooding and implosion. From the name itself, see, systematic desensitization we rank. We rank from 1 to 10. Then then the client have already taught me the relaxation techniques, right? So when I face this, I know how to relax myself. I know how to face myself. Right now, in flooding or implosion is the opposite of systematic desensitization, where suddenly I am being exposed with, suppose I'm scared, I'm very scared of creepy crawly things. Okay, if I see immediately, it produces a lot of anxiety in me. So when there is flooding, suddenly I am being pushed to the room, or suddenly so many crawling insects are there around me. Right. So flooding is a therapy in which the patient is immediately exposed to the most anxiety-provoking stimuli, instead of being exposed gradually or systematically to a hierarchy of fear stimuli. So if this technique uses an imaginary event instead of a real life event, it is called implosion. Now, flooding is what? I am being suddenly I'm scared. Let's say, for example, I'm scared of spiders. Okay, so suddenly there have been so many sizes of spiders around me. Right, that is flooding. Now, when I have to only imagine, okay, When I have to only imagine the event, that is not flooding, that is implosion. Okay? Now, so that means here a client teach me. Suppose you are in a room full of spiders. So imagine in real life. So that is the technique where only it is imaginary, that is implosion, whereas I am exposed to the stimuli, that is flooding. So the difference between flooding with systematic desensitization is in systematic desensitization, relaxation is taught, hierarchy of the stimulus of the fear stimuli is done, and a client is made to handle each and every stimuli from a lower ranking to a higher ranking. Okay, now whereas in flooding there is no gradual, automatically I am exposed like a flood. Okay. Now, aversion therapy. Now, in this aversion therapy, this work best you will understand this aversion therapy when, if you will recall, the disulfiram ethanol reaction. Okay, disulfiram is a drug which help the client to to deter or to uh, in a de-addiction therapy. Okay, now in the so when a person is on disulfiram, if he drinks, he gets those reaction, right? If you will recall in the disulfiram ethanol reaction class, okay, in those previous classes which we have discussed. Now, what is aversion therapy? Now, in aversion therapy, what does it do? The same thing, no? Just think of that. It is a form of therapy in which the patient is conditioned to avoid an undesirable behavior or symptom by pairing of the pleasant stimulus with an unpleasant response, so that even in absence of the unpleasant response, the pleasant stimulus becomes unpleasant by association. Now, let's take for example alcohol. Alcohol for a person to drink is a pleasant stimulus. Okay. Now, disulfiram when a person give a positive, a pleasant and an unpleasant. Now, the effect that comes from the disulfiram ethanol reaction, that is the unpleasant response. So when we club together, the outcome of that response help the person to change the taking off the alcohol. Okay, because if the because alcohol plus the unpleasant stimulus bring about a lot of unpleasant association. If you will recall, the unpleasant association is the client will perspire, he will have brain difficulty, he has all that. Okay, so those unpleasant association, okay, so that will be there. So because of the unpleasant one, the client will give up the pleasant stimulus. Okay, so that is aversion therapy, clubbing of pleasant with unpleasant ones. Now, CBT, we have studied about this. Let's just review where we do it individually. We take there is in-depth analysis, or only a client is helped by changing his core belief and his automatic thinking, which automatically influence the behavior. So over here, to bring about a change in behavior, you handle or you tackle the cognitive. Okay, now next, modeling. Now, what is modeling? Now, modeling, from the name itself, modeling, it refers to the learning of new behaviors by imitating the behavior in others. Like for example, we give them in a therapy session or in a controlled environment, whatever behavior that is expected from the client to pick up, the therapist or a person, that behavior is being modeled. Okay, now it is being enacted or it is modeled. Now, if the client look at it is, see, a role model. You understand this? Even the role model also comes from here. You look up, you like that person, so automatically what happened, because you like it or you like that person or you look up to that person is okay. So those behaviors, those adaptive behavior which is there in that particular person, it we adapt them and bring about into our behavior, changing or imitating what we have seen in the other person. Like for example, if I want you all, let's take for this is just an example. If there are some behavior that I want you to, that I want to change, okay, so what do? It is I model it, or I behave in that way, or I acted in that way. So you all, when you look to me, you it is remember, it is a controlled environment. So when you look up, you start practicing, you start imitating, you start doing the behavior that is modeled to you all. So automatically whatever the previous behavior gets conditioned and it gets replaced by the new behavior which is being modeled to you. Okay, are you clear, students? Are you clear so
Yes,
far?
ma'am.
The next one is shaping. Shaping, it induces from the name itself. Is modeling is someone model to you all, to a client, and the client imitates what is being modeled to the client. Okay, so that means, remember, we are discussing behavior. So a behavior which is an adaptive one is being modeled. So the client, which needs to change the particular behavior or whatever behavior which is not adaptive, imitates the model behavior and it changes the behavior. It replaces the maladaptive one. Okay, now shaping. Now, what is the difference between model and shaping? Now, let's try to understand what shaping is. Shaping is also a technique of behavior therapy. Now, what happened here? It induces new behavior step by reinforcing those approximate desired behavior. Such each successive approximation of the behavior is reinforced until the desired behavior is attained. Now, here, shaping is those who are doing art, right? So step by step, you shape your picture. Those who like craft, step by step, you shape into a desired one. Those who like writing, step by step you write, okay, until you get the desired one. So over here again, over here the theory of conditioning takes place, right? So that any behavior which we want a person to have, any adaptive behavior, you help them by shaping their behavior, by developing. It is a new behavior here, okay. A new behavior, a person learn step by step by the reinforcement that the client gets. Okay, now, so a successive approximation to the behavior is reinforced. That means every time, be it by the positive reinforcement, the negative, depending on the situation, through the theory of conditioning. So until and unless that desired behavior is attained, the client or the person or that behavior that we want the to be developed in or to be adapted in the by the person. So it is being done step by step. Now here, now in modeling, what happened? Here we learn new behavior by imitating. Okay, here we learn new behavior step by step by reinforcement. Okay, these two, please, sometimes they do ask what is the difference between modeling technique and shaping technique. In modeling technique, they learn through imitating. Okay, model. We imitate our role model. We imitate our mentor. We imitate the behavior of someone which they have shown to us by observation or by learning. So it brings about a change in mind behavior. Okay, whereas in shaping, a new behavior I learn in through the process of step-by-step reinforcement. Okay, until that desired behavior is attained. That is shaping. Now let's go on with contingency contract. I think you are not confused. These that we're doing now are the techniques of behavior therapy. What is behavior therapy? We have seen every behavior is learned behavior. Now, which behavior needs therapy? A maladaptive behavior. What is the focus in behavior therapy? We want to replace the maladaptive one with the adaptive one. Okay, now, so what is the assumption behind this? We know that every behavior is learned. How do we know? Which theory backs that? So if it is learned, it can be unlearned, it can be relearned. So which theory back this principle or back this school of learning? Deconditioning theory. We have two conditioning theory, classical conditioning theory, which is given by Ivan Pavlov, and operant conditioning theory, which is given by B.S. Skinner. Now, how do we do this behavior therapy? Okay, how do? We do by there are techniques which a person or a therapist give the behavior therapy. Now we have seen so far, we are left only with last week, we have seen so far the systematic desensitization. From the name itself, systematic, it goes through the system. Okay, that means step by step a person is being desensitized whatever the person was sensitized before. Okay, sensitized means you are sensitized to it, you are aware of it, you have learned it. Now that behavior needs to be unlearned. So how do we unlearn that behavior? Systematically we do three steps. First, relaxation technique. Then plot or construct or list down the fear or the phobia or the stimulus that bring about the fear or phobia. Now, which candidate goes for this? The anxiety candidate. Mostly the phobia candidate goes for these. Okay, so we list down and then we tackle from the lower ranks to the higher one. Okay, now the next technique is flooding. That is one. In flooding and implosion. In flooding, when it is different from systematic, is all at once a person is exposed to the stimulus that provoke anxiety or that bring about fear. Right? Now, so any stressor that cause anxiety is a provoking stressor. You understand? Please understand. Any stressor which is that produce the anxiety is a anxiety provoking stimuli. We all have stresses in life, right? We all have stresses. Why do we have stresses? Because every day we try to balance between the biopsychosocial realm and sphere. So every day in our existence we are faced with stresses. Now, why are so these stresses that brings about the 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 stress brings about the fear and anxiety? These are the anxiety provoking stimuli. So If we, a person or if an individual or me, I am being exposed, flooded with it, that is flooding. If I am only asked to imagine everything, imaginary event, okay, that is implosion. So this is the second technique. The third technique is aversion therapy. I have a problem of addiction. I like to abuse substance. Okay, I like to abuse substance. We have seen either I abuse alcohol, either I smoke, either I eat gudka, paspas, all that. Okay, so I abuse. Now, those are the pleasant because when I give, it rewards me with the pleasant reward. So, whereas I am addicted to it and I want to change my addiction. Let's take, for example, we have learned about alcohol. Okay, I want to go for the addiction. We have seen I am highly motivated. I want to quit. Okay, so what happened in aversion therapy? That is the pleasant stimulus. They pair this pleasant stimulus with the unpleasant one. Like, for example, the medicine or the drug that they gave me in my therapy, if I continue to drink with that medicine, it will cause in me the unpleasant side effect. Okay, now, so the thinking or the outcome which come from the unpleasant side effect which is associated with me drinking with this therapy, that means they have got pleasant unpleasant. Okay, the unpleasant one is the outcome if I continue to drink with this. So that one automatically will help me not to drink because I know if I drink I will get this. So rather than getting all these associated side effects, I don't want, I will not take. Right, so that is aversion therapy. Clubbing, pleasant, unpleasant. Now, next is cognitive behavior therapy. This we have studied extensively. To bring about the change in the behavior, we change in our cognition, our co-belief, our automatic belief. Next, modeling. Modeling, that means we see, if I have to throw away, if I have to change some of my old behavior, which is not adaptive one, I need to learn new behaviors, right? So, how will the therapist help me in learning new behaviors? So, this new behavior that is needed by me to learn, I learn through imitation by someone who give or exhibit that behavior. So I imitate that behavior, I learn the behavior. That is modeling. Okay, now shaping. In shaping, step by step, again, I learn new behavior step by step by the process of reinforcement. I am being reinforced step by step until that desired behavior that I need to learn is shaped in me. That is shaping. Okay, now let's continue. Contingency contracts. From the name itself, contracts. When do we, what is a contract? Contract usually is a document. Contract usually is a bond. Contract usually it is something which I make with someone that I will stick within this specific time. So, what is contingency contract? This is a technique of behavior therapy which the therapist with the client they write that, okay, I will do this is the contract that I write and that I make. Okay, now what is there in that contract? A contract specifies the behavior change desired and the reinforcers to be given for performing the desired behavior. That means suppose I go to a therapist, okay, I wrote there. If I do this well, I will get to go to a movie. I will get what? I go to a movie, I get to go out for dinner, or I go out, okay? Or all those positive reinforcer. Okay, now If I do not do this, if I do not do it, I will lose this, I will lose that, I will lose A, B, C, D. We list it out. Now, listing, saying, and writing is different. So in contingency, we write me as a client with my therapist who helped me to bring about a change in my behavior. I write. Right, so we have written that contract. The contract is with me, contract is with the therapist too. Now, in the contract, it is specified this is the behavior change that is needed. Okay. Now, to bring about a change in behavior is a positive. So, if we work on this, once this desired behavior is given, these are the reinforcement that we will get, positive reinforcement. Okay. Now, the negative consequences or punishes will be rendered for not fulfilling the terms of contract are also delineated. That means already I have written. If I do this, this is what I will get. Okay? That means behavior is formed, behavior is changed, a change in behavior is there. If I fail with whatever is written there, that means consequences are also there. That is a contingency contract. Okay? Now, extinction. In extinction, this technique is used for decreasing the probability that a behavior will occur. It is the gradual decrease in the frequency or disappearance of a response when the positive reinforcement is withheld. Okay. Now, like for example, usually, when we give therapy to, let's take for example, parents. Okay, parents, they come and they come for help that their child don't like to eat, or don't like to study, or don't like to go to school. Okay, now, so in extinction, what happens here? Parents gradually, okay, withheld all those positive reinforcement. Okay, now that means every time the child go to school, the child will get toffee, will get chocolate, will get cake, all those. Parents know best what their kid likes. Okay, so every time the child don't go to school, don't want to go to school, so that which he likes best, the parents stop it. No going out for 3 days because you didn't go to school, or no TV, or now to those no going out, no TV is old school. Now the best is no mobile, no playing, and no screen time. Right. So the more whatever the positive reinforcement is being withheld, okay, automatically, because the child wants it, right? So the behavior gradually decreases to a point that it stops. That is the technique of extinction. Extinction means where we decrease the probability that a behavior will reoccur. Okay. Now, what's behavior? Again, behavior therapy deals with a maladaptive behavior. Any maladaptive behavior needs to be addressed, needs to be taken care of. Okay, so these maladaptive behavior, when you want the occurrence of it to decrease, so what happened? What do they do in this technique? They keep minusing, or they keep stopping, or they keep holding back all the positive reinforcement. That is extinction. Okay, now time out. Time out is what? This usually they give in school, okay, a lot. In school, if you will recall, school days, teacher will say, please stand out, okay, or stand on the bench, or go behind. That is during our time. Now they hardly do all that, okay, because it is punishment now. So what exactly is time out? Timeout, it is a method which includes removing the patient from the reward or the reward from the patient for a particular period of time following a problem behavior. The best example which I can give you now, the current scenario of timeout now is the child did not do his homework. Okay, so child did not do his homework. Parents take out the mobile or take out for that particular time till that in order to immediately after he did not come. Suppose, now let's try to understand this. Okay, a child is supposed to complete homework from at least subject A or subject B or subject C, okay, on their own till the parents come up in the evening. After work, when parents return home, parents will ask, did you do this? Okay, now that evening time is a time that the child go out to play, or is a time that the child play in the video game or play in their handset. Okay, so when they come, because the client did not do the homework, because the kid did not do the homework, so immediately because of that, the parents, the mom or the dad, remove off the that rewarding reinforcement, okay, for a particular period following the problem behavior, either removing for half an hour, either removing for 1 hour, either removing for a week. Okay, some time out we used to say, no going out and playing with friends for 1 week, you're grounded, you have to be at home, right? Immediately following a problem behavior. That is the technique of timeout. This technique is used to bring about a change in the problematic behavior. Now, let's continue. Assertiveness and social skill training. Assertiveness is what? Okay, now in assertive training technique, the patient is given training to bring about a change in emotional and other behavioral pattern by being assertive. What is assertiveness? We have to try to understand what is assertiveness. Assertiveness is being able to respond or any action which is being taken by a person in understandingly whatever I want to do without hurting the other emotions or feelings of the other person in my social or personal sphere. Okay, being assertive means whatever action I do, whatever words I want to say, whatever response I want to give, okay, I give depending on my perception, on my learning or on my pattern, but that pattern should not be the one that it hurts the other one or it brings harm to the other person. That is being assertive. Okay, now, so to be assertive, you need to be to understand your pattern, how do we respond or how do we react, and then after we have understood, the client or the therapist work with us, okay, either with me or with the client, work together and teach the client to be more assertive. Let's take for example, person A. Okay, person A has a group of friends. Okay, now this person A is very passive, okay, very passive, which means the whatever his other friends say, they will say, okay, please do this. Today you have to come and we have to go out. And even if the person didn't want to go, but because he or she is too passive, the person don't know what to tell, right? And so does it bring, though it brings about the maladaptive behavior, but the person didn't want to tell. Okay, that is passive assertiveness. Okay, now, so the person didn't want to hurt the other person. Yes, he is doing the thing that he didn't want, or maybe he or she wanted. Okay, but he didn't have that capacity. He or she didn't have the capacity to tell, no, I have to finish my homework first, or I need to complete my assignment first, or then we will go out. Okay, that is passive assertive. Now, those aggressive assertiveness means I will voice out to the other person because मुझे नहीं करना. You have done this to me. What do you think of yourself? This. Okay, whatever I wanted to voice, I have voiced. But I am in the end hurting the other person around me. Now, so how do I bring about the maladaptive, how do I change my maladaptive reaction? I need to do, my therapist will do assertive assessment with me. Then he or she will try to understand how assertive I am. Then training is being given to me, right, by role play or by psychodrama or by practice in real life, okay, by role play or by psychodrama, and then I go out and practice. Every time I practice, every time that assertiveness response will come out. Okay, the more I put into practice in real life situation, that means the more I balance, the more I learn to understand or to respond in the psychosocial realm, definitely a change in behavior will do. Okay, that is assertiveness. Now, what is social skill training? Social skill training, from the name itself, social skill training. Okay, it is not professional skill training. Professional skill training is the training that we undergo as nursing personnel. Okay, we are a nurse. We have to be trained to give care. We need to we need to gain skills in, well, let's take for example in mental health. Okay, I'll take the example of mental. As a mental health nurse, we need to gain skill in taking history. We need to gain skill in running the mental status examination. We need to gain skill in maintaining therapeutic nurse-patient relationship. That's why we write process recording. We need to gain skill in understanding the the multi-stressors that is around, right? So this is the specific specialized skill. Now over here it is social skill training. Now, social skill training means in our adaptation in the psychosocial realm. Okay, how do we adapt, or how do we behave, and how do we grow in our social skills, right? So this also, now how do we know whether I have poor social skills or good social skills? From my behavior. How do I know a person A has better social skills than person B? From the behavior of a person. So if the person has problem with the social skill behavior, which are not adaptive, if we want to change that, definitely we have to teach them to change. Right? Like for example, let's take for example schizophrenia. Schizophrenic, they some, because once they come out from their psychotic, they need to relearn again. We teach them again the normal ideal, right? We teach them again how to communicate. Now, let's take for example the kids with a patient have just come out from dementia, or who is a patient have come out from delirium, right? So we need to teach them again, right? How to communicate, how to sit, how to walk, how to wear clothes, right? And so a lot of mental health patients need social skill training, right? Now, so what is social skill? Social skill training is based on the belief that skills are learned and therefore can be taught to those who do not have them. Please mark this line. Social skill training is based on the belief that skills are learned and therefore can be taught to those who do not have them. This training helps to improve social manners like encouraging eye contact, speaking appropriately, and so on. I told you, some of us we need communication skills. Some of us we need the how to sit in a table again, how to eat, what are the table manners, what are the manners that we need to behave in the community, right? Or how do we behave and react and respond now, which all of this need. Definitely, how do we know that a client needed? Again, from the assessment, from the observation, we find that the client needs to be trained again with the social skill. So that is the social skill training. Clear? Are you clear so far? These are the main ones, okay? These are the main things which usually they do apply. Okay, now I in relaxation technique, remember, when a person needs to apply all this, a person needs to learn. Okay, remember, behavior therapy is we target the maladaptive behavior. So when we target the maladaptive behavior, we need to help. We cannot just say, I cannot just say to person A, this behavior is wrong, change. I cannot say to person B, this behavior of yours is wrong, change. With what will the person change? So I help the person change, person A or person B, I help them change in their behavior by replacing the maladaptive with the adaptive. So how will they replace? By using these techniques. So what all are the techniques? We have seen technique of systematic desensitization. We've seen their techniques of flooding and implosion. We've seen techniques of aversion therapy. We have seen technique of CBT. We have seen technique of modeling, technique of shaping, contingency contract. Okay, and another one which works best, especially when it comes to a person with some behavior which we want to bring. Okay, that is token economy. Token economy. Token economy, that means if you do this, you will get this. If you do this, if you do this correctly, you will get these token. So that means it is also another part of positive reinforcement. If you do this well, you will get a token is being given, right? Or if you do everything well for 1 week, then you get to go out on a vacation, or we get to go out outside for picnic, or we go for a movie, or we go out for dinner. Okay, that is token economy. For every positive reinforcement, or for any behavior which brings about a change, a token is given. Right. So which means if the behavior is not there, the person will lose a token. So that token drives a person to learn and to change, or to adapt, or to the old behavior unlearn, relearn, and adapt with the new learned behavior. Okay, so with this, I think we have discussed all the uh, behavior therapy. Okay, now how is behavior therapy different from CBT? Okay, now for CBT, again in CBT, behavior therapy deals only with the now and then maladaptive behavior. Okay, CBT deals with the deeply seated here. With the deeply seated learning, the core beliefs, because that influences the change in behavior. Now, so behavior deals with this. So the assumption is anything which is learned can be unlearned. So the techniques, all those techniques that we have done today. Is there any question that you have? Any question you have, students? Please, another 5 minutes. I can take your question before we stop.
Excuse me, ma'am.
Yes, Mancha.
Ma'am, can you tell about shaping once more?
Shaping. Okay. Now, shaping. Now, let's try to understand shaping. Shaping is when we want to shape the behavior. Now, let's take, for example, a child. Okay, a child is beginning to learn how to eat, sit in the table and eat by themselves. Okay, I will give an example of this because you with the side by side you are learning growth and development. So step by step, like a small child in the process, like suppose a caretaker or a parent or the elder siblings feeding the child. Right now, when you want to shape the behavior that the child gets to eat themselves, we give them a spoon. Right, small spoon. Side by side, the child learns to hold the spoon first. Right, one step. Child learns to hold the spoon. So it will take few times. Some of the kids' cognition is good; they learn faster. Some kids, their learning is they learn in differently. So some they take time to learn, some they learn fast. So from the time of learning to hold the spoon, right? Recognition first that this is a spoon, the spoon is used to take from there from the plate and put it. Now, initially the child may not learn, will take time to take the food in the spoon. So that is again another step. It will take some time till the child learn to take food in the spoon. Then we have you if you will observe, if you will observe in YouTube and videos, we used to keep a bib, okay, for the small kids who are still learning. Now, when do we start shaping this? At least some. I told you, growth and development, for some it is fast, for some it is slow. Right? So they learn. So immediately when they take, they may not reach the mouth. It will drop. Then again, they try again. Then again, they try it. So this step by step reinforcing or making a person to learn, that is the new behavior. Okay, new behavior. That means a new behavior is being shaped in a child in step by step. So first the child learns to recognize a spoon, one step. Once the child have recognized that spoon, that means the child knows this is a spoon. Then next step, the child learns to hold the spoon, right? So once a child learns to hold the spoon, that means the child has learned to develop fine motor skills. Okay, so the child knows. After that, the child learns to take the food in the spoon. Initially, it will drop. Then the child try again. Then next time also it drop. Then they will learn. Halfway they will come. It will not reach even the mouth of the child. The food will drop. No problem. Again, the next step they try. So this step by step till the time the child learn to open the mouth and put the spoon inside. Now, for some initially, little bit of food will go in, all the food will go out. But that it does not matter. The desired behavior that we want to shape here is we want the child to understand how to use it. Right now, that is what. Now, I will give the example of let's take MR kids. Okay, MR, mental retardation, we have learned, we have seen in Sankhya, right? Now, those who are at the educable, so we need to shape the new learning behavior, the educable one, right? So step by step, they are being educated. Like for example, suppose we educate them into paper bag making. So first thing, we teach them how to fold it, right? So one step. That means that. Then we teach them to paste it, right? That you all have done. So the desired behavior that we want them to do, we want them to train or educate it, is being given by on a step by step shaping technique. That is shaping until a desired behavior is attained. Now, let's take for example when you had gone to daycare, right? Some of the client needs to be they cannot go to toilet, they cannot wash their hands on their own, they need someone to learn. So again, when we want now for that, we show them what to do. Right. We teach them, okay, this is the way we have to wash the hands, this is the way we do, and they follow it. Right. So that is when they imitate what others is doing, that is shaping, that is modeling. Whereas when we teach them the step by step doing, this is the way you will wear your clothes, okay, hold your let's take for example, hold your button, buttoning. That is that is a technique, bring about a change in behavior. The behavior means they know how to wear the clothes in a step by step. When a small kid is being taught to tie shoelace, right? One bunny this side, another bunny the other side, then we tie it. Bunny ears, they used to call it, right? So when anything, a new behavior, when it is being reinforced, that is step by step, that is shaping. When a new behavior is being taught by imitating, that is modeling. Now we give this as a behavior therapy until a new behavior is being attained or achieved. Are you clear, Mansha? Is there anything that you're
Yes, ma'am. Thank you, ma'am.
you're clear? Okay, anyone has any question again? Okay, so we have learned. Now let's try to continue, or let's try to connect what all we have learned. Okay, now this we have learned this as part of the treatment modalities which we give to we have done the F10, okay, substance use. We have dealt extensively with alcohol, and we know that these substance use disorder need CBT, okay, and they do need behavior therapy too. And we have seen F20, F30, F42 that they need it. Now, why have I done all this? So that you can understand the treatment. You will apply this treatment even with the other mental illness too, right? So along with this CBT, behavior therapy, all these are part of the psychotherapy which a patient gave, which we give to a client. Okay, so these are the therapies. In the process, as we review the F20, F30, F40, and as we review those theory lessons again, you will understand how these therapies come into play with the treatment modalities for the various patients. So I hope you have understood. If there's still any doubt, you can note down your question, and it will be clarified later. I have another 15 minutes more, so I will not start a new topic. Maybe tomorrow or tomorrow also I will be taking class for you. So we will do the next topic tomorrow. Thank you, students. Um, Thank you for your attention and for attending the class. Thank you.